Great. Catherine, do you want to start?
Thank
you, everyone, for joining us. This is Brown, who is PAAC's Credentialing Chair and Vice President, and my name is Catherine Bray, and I am the President. And we want to welcome everyone to the Essentials in Ethics and ADHD Coaching. Today, we will cover, learning how to do this, there we go. We'll cover the vital ethical standards established by that guide our professional conduct. By the end of this course, you'll have a solid understanding of these standards and apply them in your coaching practice. And these are the guidelines that PAAC credential coaches must adhere to. And Liz, you're
okay. So we also have, for anyone who has joined, there is a link to the page on the PAAC website with the PAAC Code of Ethics. So if you want to follow along there, feel free to pull that up as well. Basically, PAAC credential coaches are expected to uphold the highest standards of ethical conduct, acting with integrity, treating clients with utmost respect and dignity. The standards are not just rules, but they're a commitment to the ethical professional practice. So if you want more detail on exactly what that is, the breakout, take a look at the website page, and that will give you a little bit more detail.
Great. This is the PAAC pledge for me, and because this is, would someone volunteer to read this for? So important. Do I have a volunteer? It is
Adela.
I think it's, I can't see. Adela.
It's Adela.
Hi, good morning. The PAAC pledge. As a PAAC.
Good morning, Adela.
Hi, as a PAAC credential coach, I acknowledge and agree to honor my ethical and legal obligations to my coaching clients and sponsors, colleagues, and the public at large. I pledge to comply with the PAAC Code of Ethics and to practice these standards with those with whom I coach. If I breach this pledge of ethics or any part of the PAAC Code of Ethics, I agree that PAAC, in its sole discretion, may hold me accountable for so doing. I further agree that my accountability to PAAC for any breach may include sanctions, such as loss of my PAAC credential.
Thank you very much. As a PAAC credentialed coach, you do commit to honoring your ethical and legal obligations to your clients, sponsors, colleagues, and the public. And as accountability measures and account measures, including the potential loss of your PAAC credential.
Catherine might be frozen. Oh, we both moved at the same time. Okay, so understanding the balance between legal and ethical regulations. Okay, Catherine, are you?
Yes,
you're frozen for a second.
Sorry.
Yeah. See, our ethics are a set of guidelines for each of us. They're not a substitute for the law and are not meant to address legal issues or legal requirements for any kind of coaching or working with clients. If there's a conflict between your state and federal law and regulations, that you need to adhere to the law first, but also follow the spirit of the Code of Ethics. So that's something that you'll want to know. It depends on your state that you preside in, where you are coaching, what the legal requirements might be. So one of the suggestions is just make sure that you look that up and know that if there's some kind of that if there's any kind of conflict, that you're going to go with the legal piece.
Great. And this is just a reiteration of what Liz just said, but the PAAC ethics are guidelines to support ethical practice, but they do not replace legal requirements. And as Liz said, in the case of conflict, legal regulations will take precedence, But what's really important for us is that we live the spirit of the PAAC ethics, and that should be followed. So you may have legal requirements, but do so in the spirit of PAAC ethics.
Okay, so defining your scope of practice and disclosure. This is really important. So first, that the PAAC credential coaches have primary obligation to consider and protect your client's interest in making decisions with the relationship. You need to remain unbiased to serve any client population that we are, that's one of the strict tenets here. We are specifically trained by a school and work with a mentor coach to work with ADHD clients and those in relationships to such clients. We work as specialized coaches, so it's important that you keep up your training. It's not just a one and done. Continuing education is important, but that there is training. It's clearly defined in the credentialing requirements, and that's important for all PAAC coaches. ADHD is a diagnosis. While we often work with clients who have been given that diagnosis, and then also those who are in relationship to them, that we need to have the knowledge and training about ADHD and what behaviors, what issues may come up. Being a PAAC credentialed coach does not qualify us to diagnose ADHD. So that's just something important. You may suspect it, but we cannot diagnose it. We also do not recommend medications or give medical advice. We'll have a question in the case study to kind of talk a little bit more about what happens when someone asks you about medication. If you feel that a client might benefit from medication and they're not on it right now, the coach will communicate that impression to the client and encourage them to seek out medical advice. We also are not therapists, and we don't treat mental disorders. If you think that a client might benefit from therapy instead of coaching, or maybe along with coaching, the coach needs to communicate that to the client and refer them to a mental health professional. It's recommended but not required that the coach obtain permission to contact a mental health provider who is providing services so that the care can be appropriately coordinated. In this instance, if you are working alongside another mental health professional, you would want to make sure that you had disclosures, that you had consent on your side and that the therapist had consent on their side, because it is something that does happen. It does happen fairly often. We make referrals when we think other professionals are in the best interest of our clients. So that could be in a number of issues. It could be therapy. It could be if someone needs a financial planner. It could be if someone needs a professional organizer. And those are things that we are not they're not in the scope of our practice, that you will make referrals. And then finally, that we coach our clients only for as long as we believe that the coaches or the clients benefiting from the coaching. At the point where that it seems like it's in their best interest to end the relationship, then we can talk to them about that. And at that point, we would go through the closing process with that client and invite them back if something should change for them. So I'll hand it over to you, Catherine.
Thank you.
Vidya, there is not a starting word because the quiz is the proof of being here.
Great. Ensuring truthful advertising. Any marketing materials or public statements must be truthful and not misleading. And transparency and promoting your services is essential. If you can make sure that all brochures, articles, speeches, resumes, bios, and other materials that are related to your practice are true and not misleading, that is what is required in terms of the PAAC ethics. In essence, they're saying, don't exaggerate, make it true, make it transparent. Great. Maintaining client confidentiality. This is a very serious issue for us, and one that I know that we all work hard to maintain. Protecting client privacy is the cornerstone of ethical coaching. Establish clear agreements on how information is shared and understand the limits of confidentiality. We do not share confidential information that could lead to identification of a client without written or recorded permission of that client, except as required by law or if the client presents a serious danger to himself or others. Credentialed coaches actively protect the privacy of their clients in all oral, written, and electronic communications. One of the key points here is whether they present a danger to themselves or to others. And that is when we can put aside our confidentiality and contact the appropriate authority. So if you feel that the client is a danger to themselves or others, you would see who you have permission to contact, or you might even need to contact the authorities if you feel that they are a danger to themselves. Is there anything you'd like to add to that, Liz?
No, I think you summed it up pretty clearly there.
Good. Okay, great.
Okay. So the coaching agreement, setting clear agreements with clients. If you're an ICF coach, this is very similar, but it's critical that you get a clear coaching agreement before you start working with a client for a number of reasons, but that we discuss and we put in writing and have the client sign the relevant information about what the service is going to be, what the payment is, what the fees are, how you collect payment, and how you're going to share any kind of barter agreement or anything like that. We want to make sure that when we have these things in the agreement, that we honor them. If a client reaches out to them, part of the setting a clear agreement is getting back to them. So if you have in your agreement how the communication is going to go, if you say I will get back to you within 24 hours, then we want to make sure we do get back to the client within 24 hours. There's obviously some times where there's emergencies, or you can also share, this is Monday through Friday. If you contact me late on a Friday, I will be getting back to you on Monday. So just want to be really clear about that. We also have sponsors at times. So with a sponsor, which is someone who is not the client, it's someone who is paying for the coaching, we want to make sure that everyone is clear on what the rules are, what the boundaries are, and what the confidentiality will be. So it happens with whether we're coaching someone from a company, the company is paying for the coaching. We want to make sure that the company and the client sign the relationship or the agreement stating what will be shared, what won't be shared. Most likely, you are not going to share much with the sponsor, because then you won't really be developing much trust with your client. This can also be a situation if you're working with a young adult or a teen or a child and the parent is paying for the coaching. Again, very clear on who gets to know what and when, because that will also save issues. And if it's a situation where someone says, well, I want to know everything, and the client does not want that to happen, then that you would not get into that coaching relationship. We also want to have just written consent from parents or anyone who is not 18 yet. We want to talk about what the access will be, and again, make it very clear what will be shared and what won't be shared. It will save a lot of headaches down the road if you get it clear in your agreement, as well as the other logistical things. Catherine, want to add anything to that?
No, that was terrific. Very clear. Right.
Got it. Oh,
Nope,
we
too far.
there we go.
Okay, that's you. I'm going to the next one. Setting and maintaining boundaries. Okay. Set appropriate boundaries to avoid conflicts of interest and exploitation. Be mindful of your own needs and limitations, which also helps to ensure the quality of coaching services. So here are a few specifics. Credentialed coaches set clear, appropriate, and culturally sensitive boundaries and do not exploit clients, relatives, or close friends of current clients, either emotionally, sexually, or financially. Remember to attend to your own psychological, physical, and emotional needs, and make every effort to address any psychological, physical, or emotional problems so as to prevent interference with the quality of coaching services provided. Have some caution when you're entering into relationships with individuals with whom you had a previous professional or personal relationship, or someone who is closely related to somebody who you have known. Coaches should assess whether entering into those relationships could reasonably be expected to cause harm to the prospective client or to the person closely related to the prospective client, or damage the coach's objectivity or be exploitative. If you're involved in a research project, you are not permitted to exert any pressure for clients to participate. PAAC coaches are to disclose any potential or known conflicts of interest with coaching clients or sponsors. When you are talking about the records that you maintain them in a secure and safe place. And when you store and ultimately dispose of client records, do so in a manner that provides confidentiality, security, and privacy while complying with all laws and agreements. Also, when you're using electronic communications as part of your work, you are responsible for understanding and communicating to the clients the risk to privacy that this communication represents. PAAC coaches make clear agreements to adhere to the PAAC Code of Ethics with any associated coaches, consultants, and assistants, with whom they manage or employ in service of their clients. PAAC coaches respect opinions and viewpoints of other ADHD medical professionals with whom they might even disagree. Make known to a client or the client sponsor all likely compensation from third parties that you may obtain or give out for referrals of that client. PAAC credentialed coaches work with issues that the ADHD clients presents as well as with coexisting conditions. However, we are not trained, as Liz said, to diagnose or assess any brain disorders or mental health issues. We do not engage in illegal activities, including but not limited to copyright, intellectual property rights, or patent violations. We take responsibility only for the work we have performed or substantially contributed to. We do not misuse the influence in the areas of finance, personal issues, social issues, organizational or political issues, with the awareness that our professional opinions and actions may adversely impact or affect the lives of clients. We must maintain permission from a client before recording a coaching session that will be either shared with their mentor or any other party. And that we have to inform the client that we may use their contact information upon permission granted by the client for the purpose of pursuing or maintaining a coach credential. Coaches who are actively training student coaches clarify confidentiality policies with their students. And I think that is the conclusion of that. So there's a lot of boundaries that we talk about in there, both personally and professionally. And again, if you are uncertain as to what the boundaries may or may not be, please feel free to consult the ethics document that is located on the homepage and which Liz has given you a link to today. Okay. Complaints. I must be honest, we've received very few, if any, complaints. The actions of a PAAC credentialed coach may be reviewed under the PAAC Code of Ethics only if the conduct reviewed is as part of the coaching practice or the coach's presentation as an ADHD coaching professional. Individuals who have complaints against PAAC credentialed coaches may contact the PAAC Ethics Committee. Right?
Mm-hmm.
Okay.
Yeah, and one other thing about the complaints is that if for some reason you feel like you have violated one part of the Code of Ethics, reach out to the Ethics Committee in self-disclosure so that it doesn't become a bigger issue than it needs to be, and that you can work with the Ethics Committee to resolve the issue, to get the best advice on how to do it.
Excellent.
Okay, so enough of us reading. We're going to talk about some real life scenarios and looking for audience input here. So the first situation is that you've just started working with a client. They are recently diagnosed and they're wondering whether medication is going to be something that works for them. And their first question is, what is your opinion on medication? What should you do in that instance? Volunteers? Tanya.
In general, I would say that there are medications and then more natural holistic ways to help manage some of your ADHD symptoms, but I'm not a doctor and I don't have full intimate knowledge of every single medication and how it works and stuff. So I would encourage them to reach out to, in my case, I usually say a psychiatrist. I tell them that a general doctor does have some information, although it's not as in-depth, and also the interaction between medications. So finding a psychiatrist would probably be the best bet for them.
Okay, that's one thought. Any other thoughts on that or any?
Kristen has a comment.
Okay, Kristen.
Yeah, I like that. If I answer anything, it's my opinion only. I say this is not advice. I do offer that we all know people who are not psychiatrists who are very well versed because they decide to take that into their expertise and they're staying current. And so I would say that, but with a caveat that, you know, the nurse practitioners and blah, blah, depending on who they are and how interested they are, could help, and they are willing to learn. So if they're willing to pay attention to information that the patient wants to offer, like, can you listen to this first? You know, like, what's her name? Purcell, you know, I think that's also a good sign. Because psychiatrists are hard to come by, especially in plans. So, yes.
Other thoughts?
Victoria.
Victoria.
Hi. Hi, everyone. So I have discussed this with clients before, and I asked them if they would like to come up with a list of questions to ask their doctor when they reach out to them and make the appointment. And I kind of just coach them on, if they want to be educated on the different types and what doctors that they can reach out to, because there are multiple. There's a nurse practitioner, there's a psychiatrist, there's a regular physician. But obviously I always state that I cannot give medical advice, but I'm here to help you, in coming up with your own questions if you have them for your doctor.
Great, thanks. And Rhea? Oh, you're muted, Rhea.
Oh, there we go. One of the things that I do is I say I can't make any, I can't talk about the medicine. I can't put any advice on it, but I can help you pay attention to what your new dosages and stuff are doing. I can help you remember, kind of in line with what the last person just did, help you remember and how it's affecting you, and then you can take that to your doctor.
Okay. Naima?
Yeah. For me, I always have 3 pages about medication from Dr. Kenny Handelman, and it explains all the medication, every impact, everything. And this one thing, of course, I precise I'm not a doctor. I can't prescribe or have an opinion about medication. Everybody is different. Some people, they work under medication, others not. And anyway, we have 20% also who will never work with any medication. Those are the statistics. And also I have a paper that they complete when they start medication. And for me, in order to know how the medication is impacting them, and they bring this paper to the doctor too. Then I monitor with them how the medication is impacting about their sleep, concentration, everything. Then we have at least a picture in order to externalize all the words when they will meet the doctor. This is how I handle it.
Okay. Other thoughts?
Just one more. As I was talking about Dr. Purcell, I'm a fangirl of hers. I like to say that, just remind them that any side effects are too much. Dosage is not related to age or sex or weight. And I always forget the third one. But too little of the medication that you're working with can have just as many side effects as too much, which is why I mentioned, is your practitioner open to learning about where medications are nowadays, because it's changed so much. It'll keep changing, right?
Mm-hmm.
So,
yeah.
But again, just my notes is just to put a little thought in their ear. But I am going to start doing what one of you said about putting together questions for the provider. I love that.
Mm-hmm.
Mm-hmm. Yeah, so we want to be very careful about having any opinion in it. And while we may think that a psychiatrist is better than a family doctor, the family doctor might be fine. So I think what we want to ask, or if the client says, what do you think about, what's your opinion is, well, what I'm wondering is, what are you most curious about with medication? What are your feelings on it? What would you like to know? And move it more into a coaching conversation of, many of you have mentioned, what would you like to ask a doctor? What's most important to you? So keep it more from the coaching side, because even though it's our, we're saying it's our opinion, that can influence the client, and we are not medical professionals. Helping the client track is absolutely fine. There is also a part of the ethics where if you believe a client would benefit from medication and they're not on it, you can state that. But then we don't get into trying to talk them into it. We just mention it. So it's what are your thoughts on medication? How might you go about finding a prescriber or someone who can help you? So keep it as general as possible. I know many of us want to help and get in there with details, but from the ethical standpoint, you want to be very careful about how involved you get into that process.
Liz, Riley has a good point. She gets a lot of clients in her home state, and if they're interested in getting prescribed, she sends them 3 or 4 different psychiatrists that other clients have liked, with a disclaimer that she cannot recommend any of them personally and that their individual experience may vary.
Absolutely. That's a great way to handle it. I've done that as well. I also will suggest if someone is looking for a therapist to go on something general like Psychology Today and look for their area, look for their insurance, and also help them with questions that they want to ask to make sure that the provider is ADHD literate and that they know what they're doing.
Nice. And Victoria also offers to forward articles from Chat or Attitude about, so that they can begin their learning process on medications and different types of meds that are used and available.
Mm-hmm. Yeah. And for anyone who was at the conference in November, the first keynote speaker was, gosh, I had her name and it just flew out the other side. But Tracy, what is her last name? Marks. There we go. Came back to me. Dr. Tracy Marks, and she talked about the importance of having evidence-based information out there. So if you're sharing anything, you want to make sure it is coming from someone who is qualified in that. If they're talking about medications, they should be qualified before that we would share it with any of our clients. But it's Dr. Tracy Marks, and she has a YouTube channel with a lot of ADHD information. Okay, so do we want to do one more and then move to the Q&As?
Sounds good.
Okay, so you have recently started working with a young person and their parents are paying for the coaching. And a month into it, the parents say, hey, I want to know how my child's doing. What are you talking about in coaching? What are they sharing with you? How do you handle that situation? Anyone?
Heather Blackmore.
Hi, I guess if you've contracted carefully in the beginning, you won't find yourself in that position.
Yeah, absolutely. That's exactly what we want to do with young people, or if we're working with someone who is getting paid by a company. Any other thoughts on that?
Deirdre Donshan has some thoughts.
Deirdre.
Hi, everybody. To follow up with Heather, I do try to address that before we start and make the boundaries very clear and really help parents to understand that the trust between the coach and the client is so important. And, that's where the work will be done. I think like with anything, you could get permission from both sides to maybe talk as a group, if that's something you choose to do. But again, I think it's really about not breaching that confidentiality.
Absolutely. You don't want to, as you said, Deirdre, it has to be in the coaching agreement, and you can refer back to that. At times, when you're working with someone young, there's another thought to having a separate agreement, personal coaching agreement where it's very clear what will be shared and what won't. You can encourage your client to share something with their parents. You can coach them around how to share it with their parents, but ultimately, they are the client, and we will not break their trust unless we hear that they're going to harm themselves or others.
I think Jeff was next.
Okay.
Always encourage them to ask the kid to have a conversation with the kid about what's going on and try to get it from them. If they're not getting what they want, encourage the kid to ask me to coach him on how to talk to his parents about it.
Absolutely.
Absolutely.
Yeah. Any other?
Naima?
Thank you. Yeah, I will definitely be curious about what makes the parent asking that. Maybe as a coach, I'm not seeing something and they're worried. I will not give any information, but they are parents. They also have the best interest for their child or their teen. And I will be curious. And then after that, I will again reframe the boundaries and make sure we are all on the same page.
Yes.
That's how I would handle it.
Mm-hmm. Yeah, that's a good approach as well. Heather, do you have another question?
I just wanted to offer a tip that my supervisor gave me one time around working with a parent of a teen. One way of making sure that I didn't break confidentiality was to support them to communicate. So invite the parent into a session and facilitate them to talk to each other. And in that way, the young person only shares what they want. And you know, you're not in a position where you say more than they want you to divulge.
Mm-hmm. Absolutely. And again, this can happen. Sometimes a client will be, their company will be paying, and they may reach out and ask you questions. That's why you want to be very clear from the beginning of what can be shared and what is not. Ruse.
Hi. So since I work with a lot with kids, I mean, I have clients as age of 7 and up. In my contract, I have two options. I mean, if the parents wants to be involved and they want to communicate, they can choose to meet with their kid once a month to understand what is going on. And because I've learned in the last 5 years is 60-70% of the coaching needs to be done with the parents as well. So they need to be on board, and they need to first not feel guilty, but to help them with the coaching so they can create the atmosphere. So I definitely encourage them to be in the coaching sessions. And recently I've been actually not taking any clients if the parents don't want to be involved, and they're like, you know what, you need to babysit or something like that. So I make sure that it's clearly written out, because sometimes, the parent comes back and is like, well, he was lying to you, or they were not giving you all the information. So I've learned this is the best way to do it.
Yeah. So it sounds like you set up your agreement in a way that works best.
Yes.
Yeah, great. All right. Well, thanks everybody for your help. We're going to move on to the question and answer. So if anybody has a question, feel free to raise your hand. It could be on any of the ethics topics, be on a question that you are having. Heather. Oh, you're muted, Heather.
Thanks. I'm curious around what kind of complaints you've received. Are they around boundaries, or what's typical?
To my knowledge, we have not received any. I saw that Neil was on the call, and Neil was the ethics chair before. I don't know if he's has any idea on that either.
Yeah, no, we had no complaints during my tenure either.
Okay, that's good to know.
I guess that's a testament to the training that there haven't been complaints. Yeah.
Well, and it's why we have been very careful about the credentialing requirements, and making sure that there's education and experience that are involved with, the training of our ADHD coaches, because it's very important. I think it's much more important with our ADHD clients than it is just with typical life coaching. Other questions? Vijay.
Go ahead.
Oh, go ahead, Neil, and then we'll go to Vijay.
Okay. Well, I just think an issue that it can come up in this day and age, is political differences, and there's such in such a divided society that, and I think that there can be a kind of ethical issue around that, how you're going to respond or what you're going to disclose, and whether that's going to be helpful or harmful to the client.
Yeah, very good point. Vijay.
Hi, everyone. Hi, everyone. If it's okay, I wanted to share a real example where I felt a little conflicted, and I'd love to see how other people would have handled it. So recently in one of my groups, a new dad, a first baby, shared that his, sleepless nights, cranky baby, his emotional regulation was pretty bad. He was getting close to rage. But he shared this openly with the group coaching situation. And personally, I got a lot of fear around that because the baby could be in danger, right? But I also knew this was more about emotional regulation than any kind of intent on dad's part. The way I handled it was to reach out to him right after the group directly and get him resources, talk to him about things he could do to, learning to walk away. And I think it all worked out just fine. But I remember having a moment of, is this one of those times when if we hadn't been able to get him help and resolve this, and we're seeing signs where somebody could have been hurt, which would have been terrible for everybody. I'm just wondering if any of you would have handled differently, because I had a moment of, is this one of those times when we report it, or, I was worried. I hadn't been in that situation before. I don't work with children. I only work with adults. So I haven't been in those kind of situations before. So it was just, yeah.
Thanks for sharing that.
Yeah.
Thoughts?
This is Jeff. Whenever I'm designing an agreement, I always explain on the front side, if I'm concerned, and emphasize concerned about bodily injury, harm to somebody, or a felony, I'm obligated. So I use the concern thing, because if it crosses that line a little bit, I'm going to err on the side of conservative as opposed to the opposite side. And I try to be as clear on the front side to cover my butt on the back side, just for what it's worth.
Yeah. And I do have that. I think my conflict, my dilemma was more around, it's also a serious allegation for my client. If I were to go and report something like this, at the same time, you're concerned for the safety for the family, right? So I think legally, if it had come to that, I would have reported it. I mean, not reported, but gotten help in some way. But the way I ended up helping him was getting him immediately in touch with a parent coach, a sleep coach, which are all resources I didn't know are available these days. But there are sleep coaches who work with newborn babies and parents.
Mm-hmm.
Right. It's good to know that. I didn't. Luckily, I have a parent coach friend who was able to connect me and the family with help right away. And it worked out beautifully. They're doing great. He's doing great. And just recently thanked me for what he said was, I didn't even realize that it wasn't normal to be at that level of rage. And that was a safety issue. It's like, literally, you saved my baby and me. Right. But so it worked out well. And I think we handled it well. In the moment, though, till I could get him, I gave him the resources, but immediately talked to him about, in the middle of the night, even, using help, getting resources, hire a nanny for the night, get on a video call with somebody, even if you're alone with the baby at night, because you're much less likely to be dysregulated if someone's watching you, right? So we put in all these safety things right away. He was very receptive to everything. So I was able to handle everything like the same day and that sort of thing. But I did feel this dab of fear, and I was like, because I don't want to hurt him either way, right? Like, I want to make sure nothing happens. At the same time, it's a serious thing to accuse someone of, or, you know, to put that on somebody. So yeah. So I was just, you know, I haven't been in too many ethical dilemmas, thanks to, like you said, we have clarity on what our ethics are, and we set good boundaries and agreements and things like that. But yeah, that was one time that I really did feel the moment of, oh, we're, you know, life happens, right, for our clients and stuff. So yeah.
Yeah, well, Vijay, it sounds like that you handled it very well, because you did speak to him, and you also you knew it was outside the scope of your practice. You gave him resources outside, and then you followed up with him.
Yeah, no, I checked in with him a few times, because yeah, I think if he hadn't been responsive, and I, you know, luckily also knew that he immediately contacted the help that we had given him and stuff, I would have probably reached out. His emergency contact would have been his spouse, and would have at least checked in with the spouse to get that going as well. Yeah.
Great, thank you.
Yeah.
Okay, so thanks everybody for participating. Tori, can you drop the quiz in the chat, because many people need to leave. And
I have a question.
We'll stay on with you, Kristen. We're just going to give the quiz link, okay? And which answers the questions that some people who have a hard stop at 1. Does everyone see the link in the chat?
And I believe we can send it out to the mailing list of those who signed up. This is being recorded. It's going to go into a learning management system, so you'll have access to it. When you take the quiz, then we will be able to give you your CEU for ethics. It won't be tomorrow, but it'll be before December 31st. So
It'll be in the next week or so.
You'll get it. And that you'll be able to watch this at a later time. So if anyone wants to start trying the quiz right now, feel free. We'll also share it again. And we have a couple minutes. So Kristen, do you want to ask your question?
Yes, because you put down in complaint, individuals who have complaints against PAAC credentialed coaches may contact the PAAC Ethics Committee. I'm wondering if that's something we should put in the agreement, because they may not want to ask us. And then we'd have to also give a good email, which might be info@PAAC Ethics. I don't know. What would you do?
It should be in your agreement. It is in the ICF agreements that you want to be clear if you have any issues with me or my coaching, reach out.
Yeah, no, it's in my agreement, but I did include PAAC Ethics Committee, but I don't think somebody should have to Google search PAAC Ethics Committee. Like, maybe I should give contact information.
Yeah, you could.
It would be
so they could go
coaches.org. At PAAC coaches.
Ethics coaches.
Ethics.
Okay.
At paaccoaches.org.
Okay.
And
yeah,
just put
that's a pretty stable email, right? Okay.
Yep.
Mm-hmm.
All right.
Yeah, it's there.
Okay. Good then.
Great.
Any other questions?
Hannah doesn't see the quiz. Can you find the chat, Hannah? It's the little square box to the right of the P. We can also email it to you, Hannah.
Yeah, I think we'll
Follow up with the email.
So if you don't, yeah, exactly. So we appreciate all of you being here of your time. and of your commitment to PAAC and to the ethics of it. Feel free to reach out at any time. We do have an ethics chair. You can email ethics@paaccoaches.org, or you could reach out to Catherine or myself or anyone else on the board if you have anything that you want to discuss. And feel, if you do have some of those tricky issues, know that we're here to support you, and that someone from the board will be willing to talk it through with you and make sure that you feel comfortable in that situation. Also, a lot of times it's nice to keep a mentor or a supervisor, or maybe contact an old trainer from your school or from some other program and run it by them as well.
And Kristen, I think, yes, I think there's just one answer, unless otherwise stated. I think there's only one answer for
yeah, there's
for
only
question.
one answer per
Only one answer
question,
per question.
and that, yeah.
So
Okay,
thank
so
you very
we
much.
can,
Again, if you do, you can reach out to us at president or vice president at paaccoaches.org or info@paaccoaches.org. There's lots of ways to get a hold of us. But please go off and take the quiz. Remember, you're going to get 80% you need to pass. And then you will be emailed your ethics certificate, which you can upload to your dashboard, and then it will count towards your renewal.
I just want to add something, because I saw Riley mention that. So our ethics committee is going to have some forums to talk about client issues as an ethics group. And we will keep everybody notified of that, because that will go more into case studies, and you want to discuss real things that come up. So yes, that's going to happen. Marie Ambach, who I don't think is on the call, but she might be. She's the chair of the ethics committee, and she wants to get that going sooner than later. So stay tuned for that. That will also give you a CEU credit. Okay, well, thank you all, and we'll call it a win and move forward. Have a great weekend. And again,
Thank you,
thanks for
everybody.
being here. Can stop our